Hi, Mr. Drinkline. How you doing?
I'm good. How are you?
Doing good. My name is McKenna. I'll be your student physical therapist today. So, have you ever been to physical therapy
I
before?
have not. No, it's my first time.
Do you know anybody else that has?
Yeah. My friend actually went to physical therapy, and they said it was the most painful thing it's ever
Okay.
been. I'm kind of worried. I had an appointment 2 weeks ago. I don't know if I had to cancel it last minute because I just got really anxious about it.
Okay, yeah. Is that something that you're like kind of hesitant towards?
Yeah, I just really don't want to re-injure my leg.
Okay. Yeah, I understand that. A lot of people are pretty nervous when they first come, especially if they know somebody that's had a bad experience in the past. But I can assure you we're going to try to make this as least painful as possible, try to get rid of some of that pain and make you as comfortable as possible throughout the process.
Okay, thank you. Sounds good.
So basically what's going to happen is I'm just going to ask you some few questions about the injury, and then we'll go from there and move on to the more physical exam.
Okay.
So just to start out, could you verify your age for me?
I'm 24.
24, okay. And what do you do for a living?
I work at SeaWorld.
SeaWorld?
Mm-hmm.
What do you do at SeaWorld?
I'm a dancer. I've been doing that for 2 years. I actually just got a promotion.
Nice.
I trained a new crew. We do lots of performances for animal concerts, animal shows.
Okay, nice. Congrats on the promotion. So,
Thank you.
how long have you been doing that for?
2 years.
About 2 years? Okay, and about how many hours a day would you say that you work?
I'd say 8 hours a day. A performance, let's say every hour, and the occasional break halfway through.
Okay, yeah. About how long is that break in between performances?
About 30 minutes to an hour.
About 30 minutes?
Just a lunch break.
Okay. And do you get to like sit down and rest during all that, or are you still
Yeah.
up and going?
Yeah, any time that I can have for rest, I'm going to take it.
Okay. So, what are some of the physical requirements of the job? I know you said you're a dancer, but is that a lot of like moving around?
Yeah, it's lots of dancing, lots of walking. I hardly ever get a break besides my lunch break. I don't know if you've ever been, but we have a show where I play Punky the Plucky Chipmunk, sorry.
Yeah.
And that costume, we have to wear a costume. It's about 30 pounds, so just getting around with that's pretty difficult.
Yeah. Is it pretty hot in the costume?
Yep.
I can only imagine.
Yeah.
So, do you do anything outside of work to kind of keep active or do some exercise?
Yeah, actually 8 months ago, I started this running program. I've been pretty consistent with it up until the injury. It's just gotten a little harder to do lately.
Okay. Did the injury kind of stop you from doing that?
Yeah, I can't run as long or as far as I used to before.
Okay. So, do you have any hobbies outside of that other than the running program?
Yeah, with the dance crew I have at work, we used to go out get martinis at the local bar.
Mhm.
It's dumb because our job is dance, but we'll hit the dance floor every now and then. It's what we like. So
You got to have fun every once in a while.
yeah.
So when y'all go out, do y'all? You said you usually have like a couple drinks.
Yeah, nothing too excessive. We don't get wasted or
Yeah.
anything. Just
About how many drinks would you say? Like maybe on a week.
2 or 3 maybe.
Okay.
Yeah.
So what is your living environment like? Is it like a house, apartment?
Yeah, it's a single-story house.
Okay. And do you have any stairs inside of the house?
No.
Okay. So now I see you came in on crutches today. How long have you been using those for?
About 4 weeks.
About 4 weeks.
Yeah. Ever since the injury, it just makes it easier to get around.
Okay. Is that something that the physician recommended?
No, I kind of had those from a previous injury, and I figured the less weight I put on it, I'll be able to dance more.
Okay. What previous injury did you have?
I had a right hip labral tear.
Okay.
Yeah.
And did they recommend the crutches for that too?
Mhm.
Okay. So I mean, I received the referral from your physician, but I just want to see a little bit about how you feel about the injury. So, what exactly brings you into physical therapy today?
So it just hurts right about here.
Is it? So it's just right there on the back of the leg.
Yeah.
Okay. And does it move, like travel down anywhere?
No, it's just right about here.
Okay. And they're painting like anywhere below the knee, around the ankle area?
No.
Okay. What about up around the hip, like lower back area?
Not really, no.
Okay. Anything on the other side?
No.
So pretty much it's just all centered around that one area on the back of the leg?
Yeah.
Okay. So how would you describe that pain?
Sharp shooting-ish.
Sharp shooting?
Mm-hmm.
Okay. So I drew this little picture on here, so does that show kind of an accurate representation where the pain's sitting
Yeah,
at?
that's exactly where it is.
Okay. And just to be clear, it doesn't radiate down or move up or anything, right?
No, it just stays there.
Okay. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you could possibly imagine, what would you rate your pain right now?
Right now it's a 1.
About a 1?
Yeah,
Okay.
nothing too bad.
What about at its worst?
6.
6?
Yeah.
And at its best?
No pain.
No pain at all? Okay. So when do you usually feel the time where there's no pain?
Usually in the morning.
Yeah.
Yeah.
Okay. So would you say the pain is more deep inside of the leg or closer to the surface?
I'd say it's closer to the surface.
Closer to the surface. Okay. And is there any numbness or tingling that go along with the pain?
Not that I've felt recently.
Okay. And are there any other areas of pain, like unrelated to the hamstring
No,
area you have?
it's just been right about here the whole time.
Okay. So what usually makes your pain worse?
Usually when I'm at work, all the walking, all the standing, and all the dancing, just moving my leg around really makes it ache.
Okay. So about how long into the standing or dancing does that pain usually come on?
Say about 20, 30 minutes in.
20, 30 minutes?
First starts coming up.
Okay, and how long does that pain usually last?
Depends if I sit down and actually take a break, or if I keep going, it'll probably last till 20, 30 minutes after I'm done.
Okay.
Yeah.
And about how long until that pain kind of goes away?
Usually 10 to 15 minutes.
10 to 15?
Yeah. If I have ice, maybe 5 to 10.
Okay, is ice one of the things you use to make the pain better?
Yeah.
Okay, and what else usually makes the pain better?
Usually when I take my medication, that helps. If I put ice on it and just sitting down and resting, that's really what helps the most.
Okay, so how would you describe your pain during the day?
During the day, usually like I said, in the morning, I don't have anything.
Mm-hmm.
Once I get to work and get the shows going, it starts coming up, and that's when it gets to 5 or 6.
Mm-hmm.
I'll take a lunch break, it'll calm down, go back into the field, and starts going back up again.
Okay.
At night it comes down again, I'll put some ice on it. I'd say 1 or 2 right before I go to bed.
Okay, and does that pain ever wake you up at night?
Not lately, no.
Okay, has it ever woken you up before
sorry.
or kept you from sleeping?
No.
Okay, just had to make sure. So pretty much the pain, nothing really in the morning, and then throughout the day it kind of goes up and down just depending on your activity level.
Mm-hmm.
Then when you get home at night, kind of just dies off a little bit?
Yeah.
Okay. So I looked over your form. The past family and medical history looks good. I see you added anxiety to that form.
Yeah.
Could you elaborate on that a little bit more?
Yeah, for the past 10 years I've kind of had anxiety.
Okay, and like, what exactly are you anxious about?
Well, about 10 years ago I had a gender reassignment surgery.
Okay.
And ever since then, I've just been very, very self-conscious and feel like people are.
Okay, yeah.
Yeah.
So, and are you taking anything to make that feel a little better?
Xanax.
Xanax?
Yeah. That kind of helps me down a bit.
Okay, and I'm assuming that's prescribed through
Yeah.
and everything. Not many people can get that over the counter.
Yeah.
So, for this injury, did your physician have you do any kind of imaging, like an X-ray or MRI?
Yeah, he actually made me do both of those, X-ray and MRI.
Okay, and do you know the results of those tests?
He told me it was a grade 2 strain. Not sure
Okay,
what that
so
means.
did he explain kind of like what that is?
Nope.
Okay, well, later on we can kind of dive into that a little more, try
Okay.
to educate you a little bit about what exactly that is.
That'd be great.
So, are you taking any medication for the injury?
Just the Mobic he prescribed me.
Okay.
Yeah.
Okay.
He also said rest and ice is the best way to go.
Okay. So, how does that Mobic make the pain feel?
It makes it go away.
Makes
Yeah.
it go away pretty fast? Okay, and how often, like, throughout the day are you taking them?
Usually right before work when I know it's going to come out, and then depending how long I have before my lunch break, I'll take another one.
Okay. So that usually makes the pain a little better. So, and other than medication for the injury, are you taking any other medication besides the Xanax or Mobic?
No, just that.
Okay. So, could you tell me how exactly the injury happened?
Yeah. I was in my front yard. I was hanging flowers, and I was on this pot, kind of about this size, like 3 feet up, and I was hanging flowers. Kind of lost my balance, so as I reached out to kind of land properly, but my dog got in the way, and I just
Okay.
kind of had to like.
Did you have to like shift out of the way?
Yeah, and
Okay.
kind of landed heel first. My leg was straight out. It was just like a.
Okay, yeah, so the leg landed like pretty straight, like
Yeah.
knee locked out and everything like
Yeah.
that? Okay. So did the pain kind of come on like right away, or did it come on a little later?
It was right away.
Right away?
Yeah. Kind of went away and then came back at night.
Okay.
That's when I had to go get it checked out.
Yeah. About how intense was that pain, like when it happened?
5-ish maybe.
5-ish?
5.
Okay. So have you ever had an injury, anything like this before?
Not here. Like I said, I had the right hip labral tear. That was a cheerleading accident about 6 years ago.
Okay, and was that surgically repaired?
Yeah.
Okay. So that was about 6 years ago, right?
Mm-hmm.
Okay, now we're almost done here, so is there anything else that you'd like to get back to that you had to kind of stop just because of the injury?
Definitely the running program. Running for too long really makes it go. So I haven't been able to do that as much as I'd like to. But definitely working without the pain would be nice.
Okay, so get back to running and try to reduce the pain a little bit?
Mm-hmm.
Okay, so did you have to quit running because of the injury? Is that something that stopped you from running? Okay. So what would be some of the goals for physical therapy besides the running program?
Definitely relieve the pain.
Mm-hmm.
If I can get around moving without any pain, that'd be great.
Okay. Is the pain like keeping you from working or anything right now?
I've been able to work, but I'll have to step out of every other show just because
You kind of just have to push through it right now?
Yeah.
Okay. So while we're doing therapy, how would you like to learn best? Because I can teach you a couple of different ways. I know we have some handouts, or we can do just verbal talking like this, or we can do like some kind of demonstration. So what would best suit you?
I think a demonstration is the best way to go for me. Yeah.
Okay. Is that something that you're pretty used to?
Yeah, as a dancer. Just watch and learn kind of thing.
You kind of like does somebody kind of demonstrate the dance to you and you'll have to practice it a bunch?
Yeah.
Okay, nice. Okay. Well, that pretty much concludes this section of the visit today. So now we'll move on to the more physical exam. I'll have you do a couple movements